Hi, everybody. So glad that you decided to spend some time with Marvin today. We are here with Dr. Jennie Byrne for our fireside chat, and we are going to talk a little bit about stigma and which seems to be the most persistent challenge in healthcare today. My name is Jacinta Harman. I'm the Director of Clinical Services at Marvin Behavioral Health, and I'm going to talk a little bit about our guest. Uh, we're honored to be joined by Dr. Jennie Byrne. She is a psychiatrist here at Marvin, a best-selling author. She is a leading voice in healthcare innovation. Uh, what I find about Dr. Byrne is that she brings a unique blend of like clinical and entrepreneurial and leadership expertise. Dr. Byrne is a strong advocate for supporting the mental health well-being of our healthcare professionals. She is also a successfully published author. She's the author of Work Smart, which is a guide to brain and behavior science that helps to improve productivity, and also Moral Injury, Healing the Healers, which addresses the mental health crisis among clinicians in psychiatric practices. Dr. Burns specializes in caring for physicians and other healthcare workers who face challenges such as depression, anxiety, ADHD, burnout, and moral injury. And if I missed anything, Dr. Byrne, let me know. We look forward to a meaningful conversation with you today as we, you know, challenge assumptions, hopefully spark a dialogue, and explore how we can normalize mental health in healthcare together. Dr. Jenny, please say hello. Thank you for being here.
Yeah, thanks for that wonderful intro, Jacinta. Hello to everybody. I think it's morning for folks on the West Coast. I'm in Chapel Hill, North Carolina on the East Coast, so it's lunchtime. So if you're having breakfast or lunch, um, I hope you're taking good care of yourself today. In addition to what Jacinta said, if I had a slide up, I'd have some other things about me. We all show up as a complete human being when we come to work. So in addition to the things Jacinta mentioned, I show up as a lot of other stuff, just a couple of them. I'm a mom. I have two teenagers, married. I am in a rock band, is a super fun fact about me. I just had a gig last Saturday. I'm a futurist, I'm an optimist, and I love all things related to fiber arts. And if you don't know what that is, you'll have to ask me later. But those are just a couple of the pieces of me that are showing up. And I know if I had asked any of you about yourself, you'd probably list your professional accolades. But I know that you're showing up with all sorts of other parts of yourself today. And I think the more of us can show up at work as a whole person, that's one of the ways that we take care of ourselves.
Thank you, Dr. Byrne. I wasn't sure if I was free to share those things about you, but I appreciate that you shared them with everybody. I wanted to start today by acknowledging just the emotional cost that clinicians and healthcare employees carry, and to try to highlight the importance of creating a space for reflection and connection. You know, at the very core of it, this is why Marvin Behavioral Health came to be. And if you could speak a little bit to this and what you are seeing as you treat healthcare system employees here at Marvin and in your other practices as well.
This is such an important topic and obviously near and dear to my heart. Um, I think about us as healers. That's why I entitled the book Healing the Healers as the subtitle, because I think we are healers. There are other healers who do not have clinical licenses, but I think that's what we are at our core. We are healers. And many of us, probably most of us, if not all of us, throughout our careers have been wounded in one way or another, whether that's a personal issue that's happened, whether that's something in the workplace, whether we've had I say patient or client has ended their life by suicide, whether, like me, you've had to cope with something like a medical board complaint, which was very hurtful. We've all been wounded, and then healthcare has become this extraordinarily complex thing, and we're all trying to find ways to exist in a rapidly changing ecosystem around us, and often that creates wounds as well. And then the great irony of all of this is that the healers are the ones that often go unhealed.
Yes.
And if you think about the things that have wounded you and perhaps your own action or inaction to take care of yourself, and you frame it that you had a patient or a client in front of you and they told their story, often the things you're going to tell them to do are not the things that you have done for yourself. And I can relate to this. I've certainly struggled to take good care of myself in a way that lets me show up as that full 100% human being. Because I do believe, and there's some neuroscience, I always geek out on the neuroscience part, as Jacinta knows. There is neuroscience to suggest that when the therapist or the doctor shows up with 100% of themselves, that that in of itself is healing to the other person in front of them. When you show up at 50% or 25%, whether you're aware of it or not, it's going to be very difficult to heal that other human being
Yeah.
when you yourself are wounded. And this happens at a subconscious level. They're mirroring cells in our brains. Anyway, I don't want to go down a rabbit hole in the neuroscience, but the importance of showing up yourself, the best version that you can, is extraordinarily important in your ability to help the people that you want to care for. And there's a lot of science behind that.
So, in thinking about that and in thinking about why people don't seek help and just to start talking about stigma, something that can be just deeply embedded in healthcare environments, is this something that why do you think, you know, how do you think that we can address the fear that clinicians or healthcare employees may feel about being judged for seeking therapy to make themselves feel whole so that they can show up 100% of the time?
I think the first important thing to validate is that the reason that clinicians are fearful is very real. So it used to be, and in some cases it still is, a punitive environment for saying that you've had mental health challenges or substance challenges. And it's only recently been legislated. They're starting, the medical boards, for example, are starting to take that off of their application form.
Mhm.
So the fear of having recriminations that could end your career after disclosing a mental health or substance challenge are very real and they're based in reality. So I think, first of all, we should recognize that those fears have a reason. The second thing is, especially for physicians, I think for psychotherapists as well, although I'll talk about in a minute why it's a little different. The culture that we were trained in is a perfectionist, stoic culture. So we are trained, literally trained, that you are expected to be perfect. You can never make a mistake, and that you're supposed to kind of be stoic and be able to take whatever comes your way
Yeah,
and not react. And you're actually taught to kind of compartmentalize your own emotions, your own feelings, so that you can better handle crisis. So I think that's our training. Now, psychotherapy is a little interesting because many psychotherapists have had training where they get peer support and that they are trained they don't have to be perfect. And they've been given the space to explore that with peers. I've worked with some psychotherapists who get that, and then others who feel like they don't get that. So some of them feel very perfectionist, like that's the expectation. Then other ones feel like um, there's more support. So there's a little variability there, but in general, that's how we're trained. The
yeah,
other final piece I would say is that the type of temperament that is attracted to psychotherapy or psychiatry, for example, is often a caregiver, somebody who wants to take care of others, who wants to be a healer. And sometimes people who have that temperament by nature are less likely to prioritize themselves just because that's kind of who they are.
yeah. I feel like that in the systems that we are contracted with and in the various meetings that I go to, that clinicians are often told to take care of themselves. What what do you think this actually looks like from a day-to-day perspective as somebody who is a psychiatrist and working in the system?
Well, I'll first of all say that like it is really hard to take care of yourself. it's one thing to say, take care of yourself. And then we know this from working with clients, right? Like it's one thing to tell a client, take care of yourself, and they're like, oh yeah, I'll do that thing. And then when they go and actually try to do that thing, there's so many challenges and barriers and psychological things. And we know this from working with other people. We just don't think about ourselves that way. And one of the best things is like I always think is like you can't shrink yourself, right? Like I can't be my own psychotherapist. I can understand how to do that with my client, but it's impossible to shrink yourself. And so you're human and you're going to have the same challenges that anyone would or any client. So that's why sometimes having your own therapist or your own support is really helpful because you just can't really, to be honest, you just can't shrink yourself. I can tell you a little bit about like for me, how I had to work on this over the years. And I'm kind of middle-aged now. So, like I don't have all the physical resources that I did when I was 21, and running around the hospital doing rotations. But I have had to carve out a huge, what I feel like are huge swaths of time to dedicate to taking care of myself. And that's things like sleep, which I did not used to sleep nearly enough. My husband is actually a big proponent of sleep. He was pretty good at it. I've always been terrible at it. I used to sleep probably 5 to 6 hours a night, which in medical school was actually kind of a lot. Like my peers were getting a lot less. But that wasn't enough sleep. So getting into a sleep rhythm where I'm sleeping probably like 8 hours, 7 to 8 hours, that's really been a big life shift. It's taken me a long time. But to sleep 2 hours less, that means, you got to find 2 hours. I've also found that for me, I need to have a morning routine for an hour before I even get going. Now, my kids are grown, so I don't have babies. It's a little different when my kids were little. But I need a full hour of, you know, I'll just tell you what I do. Jacinta knows I'm a little bit of an open book. I have a practice where I need to do journaling and I need to do creative something. It's normally drawing, and then I need to kind of move my body, for at least 15 minutes before I'm kind of ready to go. And then so people always ask me like, okay, Jenny, that's all great, but like, how do you do that? Like, how do you get that time? How do you make that space? I mean, that's like an additional 3 hours a day. Where on earth am I gonna find 3 hours a day? And I think this is where I challenge folks I work with a little bit. There are things in your life that you have control over that are sucking your time. And I pretty much guarantee that like this thing is one of them. Um, it sucks my time, it sucks everybody's time, but you actually have control over this thing. Believe it or not, our society, our culture may make you feel like you don't have control over it, but every single thing that's designed for that device is an attention sucking um, experiment, and they have ruthlessly engineered these products to suck your attention and your time. So you're fighting against massive amounts of money and behavioral science and psychology that's pulling your time into these devices. So I always challenge people a little bit like, you know, do, are there ways that you can control that robot a little bit more? I bet there are. There's a lot of ways I've had to control my robot. It's still cranky and bothers me sometimes. The other thing I've personally done is I've decided to disengage from the news entirely.
Okay.
And you may say, okay, Jenny, that's stupid. What about like you might need to know a hurricane's coming? And yes, I totally agree. I have delegated the news to my spouse who doesn't mind the news, who doesn't get psychologically impacted by the news. And so he will watch the news and he will tell me if there's a hurricane coming or there is something I need to know. And so the mental space I've gained from not watching the news or not listening to the news at all, for me personally, has been extraordinary. The other thing is household duties. You know, there are a lot of things, and this can be a little bit of a gendered conversation, especially women, but there are a lot of things which you may be taking responsibility for that can be delegated or stopped or automated or done differently. And I don't hesitate to tell people that I do not cook and I am actually not allowed in my kitchen. My children say when I go in the kitchen, they get scared. They're like, get out of there. I'm not good at it. I don't enjoy it. I've never done it. I lived in New York City many years where you didn't have to cook. And for me, not having that responsibility is a tremendous amount of time and energy. So I'm just giving you examples for me. I think it's different for everybody, but carving 3 to 4 hours out of your day to take care of yourself sometimes is what is needed. And it's extraordinarily hard, and it goes very against our current culture where everybody values this idea of busyness. And I talked about that in my first book. I call it the cult of busyness. I think we're in a cult, and most people don't even realize they're in the cult until they take a step back.
So I feel like you're really good about setting boundaries around self-care, but for folks who might need some help with that to, maybe see a therapist and who would have somebody from the outside looking in help them to empower them to take back some of their day. Could we talk a little bit about the role of therapy and how it plays a role in well-being and just, you know, as providers, we're all people, but we've talked a little bit before, we are caregivers, all of us, and we find it hard to put ourselves first. So how do you encourage your clients to talk about therapy with peers, with supervision, with supervisors, with upper management? How would you advise that people get that conversation started?
It's a great question. And Jacinta, because you know me, I can push on you a little bit. I actually don't like the word empower because to me that
Okay,
implies you don't have power and somebody is giving it to you. And I
understood.
would say that we all have the power already. We have to give ourselves permission to use our power. So I'll just be a little nitpicky there. I don't like that word.
That's okay.
Um, but in terms of like how to start the conversation, um, there's, different people. This is where the empathy of being a therapist can come in really handy. You can put yourself in the other person's shoes and imagine like what is important to them. So if I were talking to a peer who is a therapist about the importance of therapy, I would put myself in their shoes and say, like, okay, they can relate to what it's like to work with a client. So let me frame this in terms of like, hey, I heard you say I'm only sleeping 5 hours a night and I'm super stressed out and I don't feel good and I'm struggling. If you had a client come to you and say that, what would you tell them? And let them self-reflect a little bit and say, oh, I can relate to that. Oh, yeah, I wouldn't tell a client to keep sleeping 5 hours a night. Like, no way. If I'm talking to somebody who is a supervisor of mine, assuming that it feels psychologically safe, I would say something to destigmatize, like, hey, I noticed that I am not getting enough sleep for my body to show up refreshed to work every day. And it's really important to me that I show up and do the best job I possibly can. And here's what I'm thinking that would help me get some more sleep. Maybe you're seeing clients at 8 a.m. I'm thinking if I could switch my schedule and maybe start later in the day, that would give me an extra hour of sleep, and then I'm going to show up much more refreshed and ready to go. Or, so framing it in terms of how you can be a better employee to them is kind of that empathy mindset. If I'm talking to the CEO of a company or the CFO, the financial officer of a company, I want to put it into financial terms. Like, hey, I've noticed my team is feeling really burned out, and I think that burnout is starting to create whatever errors or um, maybe they're thinking of leaving, whatever I think it's going to cause. And I'd like to talk with you about ways that I can help them take care of themselves because if they burn out and leave, it's going to be a huge cost to the company in terms of a turnover cost and a training cost. And you know how expensive that is, and blah, 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 blah. So trying to think about what the other person, like what is important to them. And
Yeah.
then I like coming with a solution or a couple ideas as opposed to asking them what to do. Because sometimes when you put them on the spot and you say, "What should I do?" then they kind of freeze or get defensive or like they don't have time to really tell you. So I like the idea of using the power you have to think about what you're struggling with and come with a couple ideas of like, here's how I think, could help. And then therapy isn't the answer for everything. So I think also acknowledging that like some of the healing can come from other sources. And knowing like the value of psychotherapy and when it really can be helpful. Like if I'm otherwise well, but I'm not sleeping at night, the
Mhm.
psychotherapy might help me with some like maybe CBT to figure out like how can I get that sleep? What are some ideas I can take to my supervisor? Maybe how do I talk to my spouse about the sleep? So having a very specific idea of like what you need help with. The tricky part is that like what will make you show up whole and feel good is different for everybody. And a therapist can help you navigate that. But at the end of the day, again, you have the power to know what is right for you. It may take some experimentation to figure out what is right for you, but what is right for me is probably not going to be what is right from you. And that's the challenge and the fun, I think, of being a healer is how do you take all your experience, all your knowledge, everything in the world and apply it to this human being that is sitting with you? Um, so I think I'm rambling a little bit, but really it's like thinking about therapy as a healing mechanism and what are you looking to heal? Like, it's not just go to therapy because everybody needs to go to therapy. I think some people, New York City is kind of famous for that. Be in psychotherapy till you die. Like, what are you seeking to get out of it? And then that's going to guide if healer, I think is a good fit for you.
We have a question in the chat from Christine. She says she's been in and out of therapy since her early 20s, but only ever for a specified reason like depression or anxiety or heavy situations as they arise. How do I approach therapy if these are in neutral at the moment, which is huge blessing to be able to say?
That's great. I love that you've been in therapy and it was very specific. So I would say, like, if the today issue is taking care of yourself and you feel like, okay, I've kind of figured myself out. I kind of know my childhood stuff. I kind of know my habits and you really just need help with the logistics of taking care of you. Sometimes somebody who's more of like a coaching oriented therapist or even just an actual coach. Coaching is tricky because it's not licensed and so there's such huge variability in like what a coach can do for you. But a lot of therapists will have a coaching way of working in their toolkit and so sometimes like a coaching um, can be helpful. If it's more, like I said, a medical, like you're having medical issues, kind of like sleeping, appetite, etc. Sometimes a psychiatrist will be a good fit. There's some like integrative care, primary cares that are also a good fit if there's a lot of physical component to it. Sometimes those can be good resources too. So I don't know if that answers your question, Christina. Oh, you're 52
Thank
now.
you so
Well,
much.
welcome to the club. Yeah, me too. It's a big transition in life in your 50s, I think. Well, maybe late 40s or early 50s.
Thank you for that answer. In the essence of looking at time, one of the biggest questions I really wanted to pose to you, Dr. Jenny, was the idea about how healthcare leaders could model vulnerability in a way that would help reduce stigma among staff and encourage them to seek support however they might need it.
This is so important. If your leadership doesn't model vulnerability, it's very difficult to create a safe space for others to share vulnerable things. So my approach as a leader to being vulnerable has been to think about what I'm comfortable self-disclosing and then not hesitate to self-disclose it. And I really learned this when I published the second book on healing the healers because as I was interviewing clinicians for the book, they started to tell me these very vulnerable stories. And afterwards, they'd email me after the interview and say, "Oh, just telling you that story, I never told anybody that. That made me feel so much better." And so then I thought to myself, wow, well, if they can do it, then I should do it. I should do it too, right? So I put a very vulnerable story right at the beginning of my book, which was terrifying. I had to ask a lot of people I trusted whether that was a good idea. But I decided to just take the leap and put it right in the first chapter so that everybody who looks at the book will see this story. And so what I got feedback after the book came out was people would send me messages like, "Oh my gosh, I can't believe you told that story. That happened to me. I have never told anybody. I was so ashamed. I have never told anybody that happened to me, but I can't believe it happened to you. Thank you so much for sharing." So if there are vulnerable stories that you feel comfortable to share, um, I think people typically respond really well to that if they come out authentically. The thing that your teams don't want to hear about is like, "Oh, I'm having a terrible day. I woke up, the cat barfed on the rug, and I stepped in the cat barf, and then my kid had a boyfriend problem, and then they were crying, and I was dealing with that, and I'm grumpy. I didn't sleep." Like, they don't want to hear like your whole life narrative and like what bad happened to you today. But if you can share some key vulnerable stories, and it's going to feel very uncomfortable if you're not used to doing that. But if you can find some stories you're comfortable to share, um, I found it very powerful. I've never gotten a bad reaction to sharing something. Maybe they say behind my back, but I've never gotten a negative reaction, and I get a lot of feedback that um, people feel very appreciative when you're vulnerable with them.
Yeah, that is the truest thing. It humanizes us. It humanizes that we are all human, that we're all fallible, that we all make mistakes, that our days aren't perfect, as people might think that they are. And it helps people to identify us with us when we share those stories. So, Dr. Jenny, I want to thank you so much for sharing your vulnerabilities today, for spending time with everybody here. I appreciate that they took their lunchtime to do a little bit of lunchtime learning, and we look forward to seeing folks next time. Thanks so much, Dr. Jenny.
Thank you.